that's not a rare path. A lot of people have taken that. I think it could be a win-win. At that one hand, you're still working, you're very on the ground, knowing what exactly will make a real impact to people's lives and to the industry. On the other hand, in the academia, you have the right methods and approaches and the committee to guide you to do solid research. So that might be something you could, start working on, even if there's opportunity. Let's say tomorrow you have a great offer from a grad school, you cannot say no, and they don't allow part-time arrangement. Well, go for that, because you have the passion and interest in the industry. When you pick an advisor, when you pick a topic, keep that in mind, and always keep your fingers on the pulse to see what's going on in the industry, particularly which industry you have interest on. Do that homework, and that can help you as well. Do the internship during the breaks, do the internship in that area. It will help you right after the school as well. So I say it doesn't matter which path you take, deep down inside, you have to prepare for both sides.
Thank you so much. Yeah, it's a very valuable advice.
Since we've started recording, also kind of just building on that, like the grad school, can you talk a little bit about like your career path? I know you might have touched upon it earlier, but just to like kind of in more detail go into like how you've gotten to the position that you are here at today.
Mm-hmm. Mm-hmm. I started, I actually went to medical school in China. I was an internationally trained anesthesiologist back then, and then worked in a hospital in China prior to coming to this country. So in my wildest dream, I remember yesterday there was a question about in your undergrad or in many years, was there anything you didn't think you would know? If you knew better, what would you do? I can tell you honestly, I didn't know I could be where I am now. But now looking back, I think that was not completely an accident either. Anesthesiology, that department was the most digitalized department in the hospital. Back then we had a ventilator, we had a bedside monitors, we had all kinds of medical devices, all with digitalized information, while the rest of the hospital was still flipping through paper charts and dealing, never heard of electronic medical records, so on and so forth. So I thought that opened the door for me to know that, part of the medical practice is not just listening, talking to patient and treating patient in the traditional way, but you also have to deal with vital information, vital data, and deal with how to store them, how to retrieve them, and how to make sense, get the insights out of them. So that really motivated me to go pursue further training in computer science and biomedical informatics after I came here. And then for a while, I thought, maybe then people will think, the medical field will think I'm not a real computer scientist, and computer science field that I'm not a real doctor. Why am I in this weird situation that I'm not in either? But then as time goes on, I feel like, this is a wrong understanding of the multidisciplinary. If you look at what's going on next to us in this world, you will see in the future, multidiscipline is a must for what you do. You can't expect a physician not to know anything about data, about the patient data and how to analyze it to be able to produce good research and practice. So with that, I feel like my career was sort of led by the trends of what's going on in the world and in the industry to where I am now, to be able to be the liaison between industry and healthcare. I hope that answered a little bit of the question. And talking about the industry and the academia side, just to the same question I answered previously, I think, on one side you feel like the theories, the methods, but fundamentally what important is just not how many papers you publish, is what kind of real impact you have. Can you really improve people's lives?
Thank you for sharing your career. I know some people have just joined. Does anyone have any questions about what Dr. Zhu talked about, or any other questions?
I can add a little bit to what's that for, when I was in undergrad, I didn't think Google, at that time, probably the co-founders of Google didn't even start in the garage yet. So I didn't think Google would become one of the most important things we can live without today. Not to mention Google already has started the Google Health business and trying to help us in healthcare. And so are so many other big companies. I won't be surprised that Amazon is already doing things. Um, so, for one advice for you guys is just to always keep in mind that technology is always advanced. And if you have the mentality of being a perpetual student, keep you be agile, be alert, be adaptive to what's going on there, at least to know how it works and what it does on the very general level, you will be able to keep an open mind and be ready for the next evolution of the industry.
Yeah, thank you so much for sharing. I guess another, what's some of your favorite experiences with, because you have a very diverse background within the academic setting, and then with all these cross-industry disciplines, what has been your favorite experience with being able to combine all these fields during your career?
Yeah, I think I touched on briefly before. One of the favorite experiences when I started informatics, people always stopped me and info what? Could you explain what informatics meant? At that time, the electronic health record adaptation rate was less than 10%, single digit, maybe 7% across the world. So many people, so many clinics are still dealing with paper charts. And so I felt like I was one of few people who are in the field that nobody really knew that much about. And I was lucky that soon after that, just a couple of years after that, the EHR adoption rate went up to 70-80%. And so many companies came out, and telehealth and Flatiron, Semaphore. So many companies are coming out using data science, using information technologies to deal with healthcare systems. Startup companies and blue chips companies are all shifting gears and stepping into healthcare. IBM, Pfizer, and they're all doing great things in that area. So I feel like, it's like surfing, and you see the tide is coming, and then you really ride it with it. And then along the way, you see so many wonderful things happen. So that was one of my favorite experience.
I guess, does anyone have any questions so far about anything that Dr. Zhu has mentioned? If not, we can also, could you also briefly talk about your current position at the Center for Biomedical Data here at Yale, and what most you enjoy about that position, like the different experiences you've had on that job, and any interesting projects you might be working on while there.
Sure. So for those of you who don't know about this center yet, the center was directly initiated by the Dean's Office from School of Medicine at Yale in 2018. It was meant to be a center of the center, sort of building up the platform and establish the environment for different PIs and different faculty members and students and trainees to be able to connect, communicate, and collaborate. And in the end, to break down the silos that we normally see in some sort of academic setting, that individual labs will work on their own things. They're not sharing, they're not communicating, they're not working with other together. So hopefully we can bring down the area and be able to foster this. The more we share, the better we make things environment and deliver better research and better care. So we do have 3 pillars here. One of them is education. The other one is the research And then third one is practice. Practice not only we mean by helping with medical practice in the school, in the hospital, but also practice in the industry, in the real world experience sense, that people are learning certain things that can be applied in industry applications. Educational pillar, we have many programs. We have a training, we have courses, we have some summer courses. So you can spend 1 week learning about the basics about health informatics and biomedical data science. You can learn databases and SQL, the query language. You can learn about the Python, how to program. Even for people with absolute background in programming, we're trying to introduce certain things, then you can take it back, apply to what you do either in biology or pathology. Some basic science people, some medical students all applied for it. We've been successfully running that for several years. Similar courses, more advanced, machine learning for single cell analysis, AI and data mining were in planning. And we also, for better research, we provide a seminar series. We have the single cell research in progress seminar series. We share different labs will present not only the educational topic, but diving deep how you do it, have some technical demonstration, share some algorithms, and do journal club and so on and so forth. If anyone from Yale are interested, feel free to email me afterwards. I'll be more than happy to share the link and keep you posted. For people outside Yale, we might be able to host a symposium. So we'll definitely keep you posted. We have the center's Twitter account. You can also look me up on the LinkedIn. Be happy to share. We have a center's website. For the practice side, I'm very open. Since I'm coming from the industry, I'm very open to the industry collaborative sort of arrangement. It could be a fellowship. Industry will be one of the sponsors, and we'll be training the fellows, and we have a rotation for them to be able to practice, join some projects in industry. Vice versa, we have a industry people can come over, meet with students, have roundtables, participate in symposiums. So that's ongoing and sustainable. Stay tuned. We'll be announcing some collaboration very soon.
Yeah, that sounds really exciting, especially on the Yale side. Does anyone have any questions about more about the work at the Center of Biomedical Data Science? Or also, if anyone wants to chat the questions, it's okay too. I know speaking in the meeting is not feasible for everybody.
It's very easy to reach out to us, actually. It's a CBDS. CBD stands for Center for Biomedical Data Science. CBDS@yale.edu. So if you have any questions, just email that. We'll be able to, I can put it in the chat as well. Yes, you did it. Thank you.
Maybe, do you have any advice for our participants, since there are a lot of great ideas today? I'm sure there's a lot of people who will be very invested in their ideas and will want to actually move forward with their idea in the future, how they can approach that, and any advice you can give for them.
Sure. In addition to the advice I just gave you, be a perpetual student, so always keep an eye on what's going on in the technology field. I feel like we also need to pay attention to some new trends, some paradigm shifts. For example, one of them is in the healthcare industry. You can see clearly the focus has shifted from the traditional disease diagnosis, disease treatment, to sort of disease prevention, health promotion, and wellness maintenance. Because we know the 20/80 rule still applies. Basically, the 20% of critically ill can spend more than 80% of the entire healthcare expenditure. So when someone already collapsed at home, the ambulance is on the way, it's too late. It's too late, and the cost is tremendous, a staggering number of costs if we aggregate in the population. So the best way to reduce costs and to improve the quality of life is to prevent crisis from happening. So then in that, we also see that the healthcare industry is shifting from the fee for service. Every time you go see the doctor, you will receive a bill, to value-based and outcome-based care. So that had been pushed by so many organizations. So hopefully in a few years, we will see some earth-breaking progress in that. So these are all important trends. Keep in mind when you come up with solutions and try to do your research or set up your company, etc. Another trend I would say is that in the past, the solutions were often designed around the provider, the clinicians. They're still the key player in the healthcare system still today, but more and more people realize the power of patients. So now there's a new push for patient-centered solutions, patient-centric solutions. And you can tell from the digital health itself, from citizen science and the patient-generated health data movement activities, here's clearly they're gaining more and more attention and attraction. And I think that actually aligns well with what I just said. Aging populations trying to find a better way to manage their comorbidities. And the healthcare industry is shifting from disease diagnosis to wellness maintenance. Then it's in our hands. The power is in the patient, or even people not sick yet, people at risk, regular citizens, just like you and me, to have control of our day-to-day well-being. So, and then with the sensors and monitor medical wearable devices, all of that, we are able to do that. 20 years ago, even if we wanted to, we were very limited by the technologies. And now with the advancement of technologies, we're able to do that. How many of you have been wearing something like a Fitbit, Apple Watch, and things like that? So it's everywhere now. It's pervasive. It's health everywhere. So maybe this is the time for us to really have the real healthcare system instead of the sick care system. So that I think, keep in mind, well, you continue your study and your exercise here.
Thank you. Also, I guess since we are a hackathon and you are one of our mentors, perhaps could you speak about what motivates you to engage with mentoring with all the young minds and the innovative hearts at this hackathon?
Sure. I remember there was a joke when I was in school. We were told you have to know about the theory and practice. Theory is when you think you know something, but it doesn't work. And practice is when something works, but you don't know why. And by combining them, it means, nothing works and no one knows why. So we were all like, when we're a student, oh, that's what the school means to us. That's probably hopeless. But now thinking about it, when someone said that, it probably means opportunity for us. When the problems is important enough that people tried everything and nothing worked, and people still don't know why, that seems to be an opportunity underneath there and crying out for help. So and then we had a classmate who stepped into that field after grad school, didn't even go to industry or academia, started his own company trying to solve some real problems, matching the right patients into the right clinical trial. Quite inspiring, I think. Like Dr. Harlan Krumholz yesterday said, this is a time you're not really being pigeonholed into one sort of a thinking. You're like a blank paper. You can write any way you want. You're so creative and innovative at this point. So I think that's a great potential. That's for you to explore the new industry, something no one has set the footprint in.
I
Yeah. I also want to add to that what I said about technology. You have to keep learning. That's not only true for an individual, but also true for a team, for an organization, for a company, for an enterprise. My experience, you can tell I work for several blue chips companies. They have been Fortune 100, Fortune 500 for years, and some had more than 100 years of a history. As and more than 300,000 people, 400,000 people. And you see that I've seen so many business cases and business turns that made me realize creating a plan for faster learning or faster turning around, faster changing the direction is something successful business leaders do almost by instinct. On the other hand, what's sad is if you don't do that right, if you don't do that even quick enough, if you don't detect the right trend, if you only do it reactively, not proactively, your team, your company, your business, that could be catastrophe. The competition is so hard. If you don't move forward, you're behind. If you pick the wrong direction, if you ignore the trends, if you are willful in your own way, then any company with 100 years of history could go bankrupt in no time.
Thank you. Yeah, that's really beautiful. I guess something with the business models that I had a question about. I do think it's really important to create a more patient-centric healthcare solutions. And I guess speaking because there is, like, for example, for the hackathon, there is a business project, a business like side to it. I guess that connotes that there's revenue involved. So how do we continue to uphold the business models while making sure that it doesn't harm the patient and it keeps it patient-centric? If that makes sense.
Yeah, makes sense. That reminds me of a lot of companies who started not with a pie in the sky sort of a business model, but start from a story of their family member, someone in their family getting cancer, getting certain disease, and then they just came up, they couldn't find the right solution in today's world, then they came up with a solution and became so successful. I like that because it's so down to earth. You're always connected to what exactly you want to do in the end for the patient. One lessons I learned from industry is so many teams try to present and impress the world and saying my solution is so comprehensive. We can do all of these, a long list of things. And the investor could be looking at it thinking you guys are trying to boiling the ocean, fixing the universe. A lot of times you only have a few minutes to present your ideas. So not that the more comprehensive, the bigger your plan is, the better. In my opinion, to focus and to simplify. So here, you simplify to exactly what will make a difference for you end users' lives, for the patient, for the cancer case, for whatever, then keep it clean and simple. I'd like to borrow something from Albert Einstein. I think he said, we should make things as simple as possible, but not one bit simpler. So you gotta do all the functions and the features you promised to do, but not overcomplicate, not confuse people. You sit there, give a 3-hour presentation and through all these features, and people will be completely confused about what you are trying to do. So have some priority. For tomorrow, how many minutes do you have to present? 15 minutes?
I think it's 3, but
only 3 minutes. So that's even harder. That's even harder. That's called the elevator pitch. You run into someone in the elevator. You only have 5 minutes to tell him, here's the problem and why it's important. This is how we're going to do it and why you think this is going to be successful. Yeah. And another thing I say is a problem well stated is a problem half resolved. So make sure you know the root cause of the problem you're facing. And when you're doing the problem analysis, a lot of times the solution becomes clearer.
Thank you for the advice. That's very helpful, especially for me while working on my own project. I don't know if anyone has perhaps questions somewhat relating to their projects that they would like to ask Dr. Zhu, or if there's anything they missed that they would like to hear from Dr. Zhu. I know not everyone was here from the beginning.
Can we ask opinions regarding our project, or kind of like a mentor, or?
Yeah, well, if nobody else has any more questions, I'd be more than happy.
Yeah, as long as you're comfortable. Because this is a fireside chat, so we're all here.
Yeah, well,
yeah,
it's
if you're comfortable, yeah, and go ahead.
You're recording this.
Yeah, I am recording.
Yeah, you're on recording. I don't know if you guys are, have to keep it confidential and secret with each other. But if you're okay, I'm okay. Okay. All right. Yeah.
Yeah.
So after that, I will be in the Genius Bar. It will be a totally different Zoom link. I can post it there. Let me see if I can find it.
Yeah. So the Genius Bar, all the appointments have been posted. I don't know if the Zoom links have been posted, but you should be able to see when your team is going. And there will be, I think, 5 different rooms for the Genius Bars.
Okay.
So go to whichever one your team is assigned. And there will be floating mentor sessions afterwards as well.
Mm-hmm. Mm-hmm. Yeah. So a lot of the times the solutions are just, simple means, common sense. And for you to be able to think of something is good, but to be able to realize it and implement it, that's a lot harder. So perseverance, that may not apply to today's hackathon, but will go beyond the hackathon when you do something. You never know. Maybe you'll meet someone today and will be your future teammates and co-founder of the company. Who knows? You'll be the next Bill Gates and Paul Allen. You never know.
Can I ask a question? When
Sure.
you determine whether a startup is a good idea, do you look more at the statistic aspects of it, like if how much, like maybe the background of the co-founders and stuff, or do you just go over instinct to think if just by common sense, will this idea work? How would you determine whether a startup has a potential?
Well, for 2 things, the background. If the background is just about where they went to school, what kind of grade they got, it maybe carry less weight. But if the background means they had launched 5 or 3 or successful business, and this demonstrated a track record of a successful serial entrepreneur, I think that background is quite important, vital. A lot of people will pay more attention because you could do once with mere good luck, but if you do it over and over, there's something about you and the team that's quite critical. And I borrowed the case of the Flatiron, the 2 data scientists who had no experience in healthcare. They started, and before that company, actually, they started some media company and sold to Google for 81 million already at the 24-year-old. So I think that set a good track record to say that they're making small investment in different areas before committing to only one point of view, one point of perspective, and then become successful. So that's a good thing. But fundamentally, I feel like you still have to have a solid business case. The people will be helpful, but what you do eventually will make the case.
Thank you.
Yeah.
I guess out of curiosity, I hope this is okay, because I think most people have a project. So, but I just like, what type of ideas or projects do you kind of hope to see to come out of this hackathon this year?
I really like the four themes, but wearable devices, I have personal invested interest in it. I'm the vice president for the membership chair for the membership of the working group, Consumer and Pervasive Health Informatics Working Group for the American Medical Informatics Association. So there is about pushing digital health, having citizen science, having patients being enabled and engaged. And what can they do? What kind of patient-generated data they can provide? A lot will be coming from the wearable devices, and then sensors or things they can collect on their own. Even their the survey questionnaires, but they can conduct that with more precision and at a more frequency. So that's something I'd like to see more. I think comparing to the electronic patient record, this is a new trend of data with a large volume, quite a variety, and the velocity while we're speaking, data being measured and stored, tens of thousands of data points are being captured. And then that's a quite new field. We haven't really had that kind of a challenge before. And the veracity of the data. Do wearables and sensors provide reliable enough data? So I'm curious about this, and I'd see some, what kind of ideas people can come up with. And that's related to the clinical trials as well. Could be from the logistic perspective, could be drug discovery. Now you have more data points. You can foster a platform and see the interaction and correlation among and between different data points that you've never seen before, was not obvious before. So that's one. Another is the epidemiology part of the public health trend. We are here doing Zoom for a good reason, right? It's COVID. We're witnessing the history. But like Karen said yesterday, COVID accelerates Google to push a lot of projects forward faster than they originally planned for. So I think every cloud has a silver lining, every problem is an opportunity to solve in disguise. And every crisis we face could be an area crying out loud for solutions. So what can we do over there? I don't know if you guys watch the stock market. There is a company called Teladoc. They have a headquarters not too far away from here in Westchester, New York, just a couple of 1 hour away. Teladoc was actually started in 2002, long time ago, for years, and didn't really get a lot of attention, right? We and well, comparing to other companies, they're already doing well, but I think before 2019, the stock price was like stabilized around $100. But when they started IPO, it was $19. Last year alone, the stock price went up more than 100%. So now it's trading at 260 and it's still going up. Telehealth has been telemedicine has been discussed and talked for years. And COVID, this crisis obviously pushed the things forward, accelerated in the speed that we never imagined. So what kind of things we can do? Maybe this is gonna be the new norm, you never know. And one thing we learned is life is quite unpredictable. For every crisis we face, let's think about what opportunities in disguise. Did I answer your question, sort of?
Yes, yeah. Maybe also, I guess, like bringing like COVID, and this is just, I don't know how related this is to the hackathon, hopefully today. Just how do you see, I guess, like big data and like just like all these innovations happening, how this pandemic has affected moving forward? Because I don't think, like, I personally don't think we'll be going back to the normal from before. I think when everything resolves, there's going to be a new norm, and just how this affects all the innovations and technology compared to before.
Mm. I'm optimistic about that. I feel I see more opportunities because of this. Because data science, you can do a lot of data science from different areas, and so many data were generated during the pandemic. I would say it's an ecosystem. Now, staying at a home, ordering things on food, ordering food online, these things we probably didn't think that was related to healthcare, but now I think so. Working from home, how many hours you actually move around, how many hours you stand, what kind of grocery store you order things from. In my previous ideal ecosystem solution is like, this is smart living, this is smart health, but we lack the data points to do that. But now maybe we can bring things together. We can have a picture, you digital journal, and then you will have a digital advisor sitting on your shoulder, telling you this is something maybe not recommended, or good job. Now we're locked in. We're locked in. We have to collect those data and then come up with some insight with that. So I think that's a good thing. And then once we have the data, that can be turned into useful information. Once we have the information, maybe we can do some inferencing, reasoning, and logic behind it. And that's intelligence, that's wisdom. Once we have the wisdom, maybe we can come up with sustainable action plan. And in the end, if people don't change the behaviors, a lot of data, I mean, that's an end goal. We want people to change and alter their behavior, to have good habits, to prevent things from happening, right? Go back to the original point. So maybe we can actually close the loop and do that now. It's not easy, but we have to do it. And technology wise, I'm biased. I think it's very important to improve certain algorithm from 80% of our AUC, area under curve, to 85%. But in the end, we have to ask why we're doing it, what problems we are solving. And if we do improve 5% of accuracy, will be the real impact.
Thank you for your thoughts. Does anyone have some other questions, general or business, that they'd like to ask Dr. Zhu?
That is never good until worse happens, right? We learned that. So yeah, I think now we only have one day for the hackathon, but do what you can, where you are with what you've got, and then this is a practice. Like I said, try to connect with someone who doesn't overlap with your own expertise. And that's how other successful co-founders did. But this could be something, great opportunity for you to learn as well. And this can be long, ongoing, sustainable. This friendship and teammate and this partnership can go way beyond today. And don't be afraid to say that, oh, we're not perfect, we don't have enough time, we're only undergrad, we don't have the expertise, and this is not perfect. Nothing is perfect. So we have an old saying that a diamond, a valuable thing with a flaw, is better than a common stone that's flawless. So the concept, if you see this is a good theme, this is a good direction, this is something with real value, even if you messed up with the presentation with some little details here and there, but I think the judges will see through. And when you do your presentation, make sure you state the problems well. Try your best to identify what are some existing solutions out there, your key differentiator, your competitor, your competitive advantage over this. And, you know, not pie in the sky is not a good choice. Who's going to benefit from it? It can be very simple, can be very straightforward a solution, but as long as you make that a story really sound.
Thank you so much for sharing.
guys. Yeah. I guess if there are no more questions, we could end here, and I guess I'll stop the recording here. I guess there's still 9 minutes, so if anyone wants, we can finish, and then if there's anyone who wants to stay behind to ask Dr. Zhu a question before she has to leave for the juniors bars, we can do that.